Hi everybody, it's me. It's Dr. Kestler from Lorain County Community College. Just a quick announcement about today's video. I will not be doing one over the weekend. Okay, first of all, let's start with my temperature. And I want to spend a second talking about the temperature. It's going to become important later. I'm 96.5 degrees Fahrenheit or 35.8 centigrade. And temperature taking is an important thing about contact tracing. So as we go forward, I'm going to tell you a little bit about how that works, how contact tracing works, and it's going to become very important as we start to open up, which is eventually going to happen here. Okay, first of all, I think I mentioned this yesterday, but the FDA has officially called for not telling people to use malarial drugs for this COVID-19. That appeared to be a something that was just not quite right. I mean, that a lot of things in, as I've mentioned previously on this, many times you try something, it doesn't work. Most things don't work. Most drugs that we started development fail, and very few get through. And so all the people in the drug companies know this, and this is something that you just live with, that it doesn't always happen. I know a lot of people are without insurance. We talked about that also yesterday, and I just want to remind you all not to despair. Some way or some other, the government is planning on covering. I'm not sure if this is official, but it has been proposed that the government will cover COVID medical costs. We have at least 28 million Americans without insurance right now, and people make decisions about health care. We know this already. People make decisions, and sometimes bad decisions, about health care. I just want to mention that you should seek health care. It is a good time to do so. If you are in a desperate situation, please do not do anything foolish, do not inject disinfectants. Do not drink them. It is definitely going to actually create more problems. Your illness that will occur as a result of this action will put a greater burden on the healthcare system, a greater burden on all of my soldiers who are out there on the front line fighting a battle against this disease. We do not need any more problems, so please do not even think about doing this. Don't. And if you hear somebody talking about them, tell them not to do this whatsoever. No, do not inject disinfectants. Do not consume disinfectants. Those are very dangerous kinds of things to do. I want to point out that we are moving towards reopening, and that's going to be the big topic of today. And I want to just point out that we are, if you take this as an average, the red line is a 7-day average of new cases, and you can see we've kind of reached a plateau. That's really not what we want here. We want to see stable decline is what we really need to see. We need to see stable decline before we reopen. So I caution you all to keep going forward and keep doing the good things that you're doing here. And one of the problems that we have with this disease, and this was a paper just published today, a couple papers. One was an editorial about asymptomatic transmission. Asymptomatic transmission, I think, is no doubt a real thing in COVID-19. So you can be not sick at all and be passing it on to other people. And this is some results that they saw from a nursing home out in Washington State. So you need to be very, very concerned about that. And so what that means is that how do you be concerned? How do we move forward? How do we do contact tracing? That is something that you do. Let's say you're at home and you decide to leave home. You live with your spouse, your spouse is B and you are A, and subject A goes off and goes to work. On the train, they're in contact with people. At work, they're in contact with people, and then they come back home. Subject A develops symptoms the next day. So what needs to happen? First of all, you report symptoms out. You get a home test if one is available, or you somehow get tested. If you do get tested outside of the home, make sure you wear a face mask on the way out to the healthcare facility. You want to make sure that you are safe. And then what you're going to do next is when they determine that you are positive, if they determine you are positive, then they're going to ask you to contact people, to give people you've had contact with. Also, we are going to move back and request that the train be decontaminated, that the workplace be decontaminated, and that everybody else start social distancing. Everybody else in the list start social distancing, and that they start taking their temperature every day, and actually reporting it into to the state and here in Ohio. The governor was talking about this a little bit today in his report, or whatever state, New York State or wherever you are, report back in to the health department, and then they are going to request that your contacts check in for the next week. What was your temperature today? What was your temperature today? What was your temperature the next day? The next day, just like I have been doing for the last month and a half on these reports. And then if they come positive, then we go after those folks and we do the same sort of analysis. We do the same sort of a thing. This is how we will solve the problem going forward. This is how we open. This is how we open. We don't open up and say, all right, everybody, let's go, have a big party in a closed building where everybody's all at once in the one place. That's not the way to do it. The way to do it is slow and to do contact tracing. Contact tracing is the way that we get back into business. If you and I'm just going to leave you right there for the weekend, and I'm sure there'll be plenty of things that we want to go over on Monday. I just want to remind you that if you know somebody in a desperate situation, if you know somebody who is desperate for a solution, please urge them to go and get legitimate health care. Urge them to go and to get legitimate health care. And that will be that is something that is there. We have capacity. I want to point out at one point I'm going to do a story about the job that different places have done. New York City, for what you can say, for the massive number of cases, has done a remarkable job, a remarkable job at keeping people alive. I know you talk about all the deaths. There's a lot of deaths in New York City. We went over 50,000 deaths here in the United States today. That happened today. 50,000 people lost their lives due to this epidemic today, as of today, and that is very sad. That is very sad. But we need to support each other. This is an effort. This is a war effort. And we all need to treat it like this. We all need to support each other. We all need to make sure that if there are people in desperate situations, that we are the helpers. We need to be the helpers. We need to get them to a good place. And I'll stop right there and say, have a good weekend, everybody. And be good to yourselves. Be good to each other. And may you persist like a lentivirus.